Hi folks, Dr. Gus back again. More about the kidneys. If you remember last time we talked about the two major instigators of end-stage disease, which then land up requiring support like dialysis and transplantation. We'll be talking more about dialysis and transplantation, what that means in the future. But are there anything else, any other causes, any other risk factors that are associated with the development of chronic kidney disease? And indeed there are. Certainly, high blood pressure, diabetes are two of the major instigators of end-stage disease, of all forms of kidney disease. But there are a couple of others. In minority populations, and especially in the African American population, there is a much higher incidence of chronic kidney disease development than in Caucasians. The same goes for Hispanics. So those of African American descent, those of Hispanic descent and Asian descent, those folks tend to be at higher risk for the development of this disease. Much of this is unknown as to why, but the fact remains that those folks are at risk. So if you are African American, if you are Hispanic, it's important that you take extra note and be very, very aggressive that your doctor screens you properly. And we'll talk about what this screening is to involve. The other thing is family history. There are some kidney diseases which are actually genetic. And so a family history of kidney disease could be very important to know. And so if there is a family history, that needs to be drilled down a little bit further and needs assessed by your family doc and probably referral to a kidney specialist such as myself. The next category is elderly folks, those over the age of 60. Unfortunately, I fall in that category. But anyone who is greater than 60 years of age is also at increased risk and needs to be very aggressive in following with their family doc to do appropriate screening. And the next time we visit each other, we'll talk about what kinds of initial screening tests can be done to see if you are in one of those at-risk populations. So next time we meet, we're going to talk about a couple of those risk factors and what we can do to identify whether or not we belong in that high-risk group. So I look forward to seeing you next time.